Hi everyone, my name is Joseph Pereira. I'm a fourth-year medical student at Harvard Medical School, and in my work with the Down syndrome program at the Massachusetts General Hospital for Children, I prepared this talk about attention deficit hyperactivity disorder, commonly referred to as ADHD, in individuals with Down syndrome. This video is meant to be an educational resource for families or anyone looking for more information about ADHD in this population. Here is the outline for what will be discussed in this video. First, I will describe what ADHD is and connect it to Down syndrome. I will then describe the symptoms of ADHD, how it's diagnosed, as well as the currently available treatment options and next steps if there's a concern about a possible diagnosis of ADHD. So what is ADHD? ADHD is a neurological condition. At the core of ADHD are problems with attention, impulsivity, and hyperactivity. ADHD is broken down into 3 subtypes, which will be discussed in detail in the following slides. The hyperactive impulsive type is known to be more common in children, while the inattentive type is more common in adults. The combined subtype meets criteria of both the inattentive and hyperactive subtypes. It is important to recognize and treat ADHD because it can cause significant impairment in an individual's personal, educational, and social arenas. For instance, if an individual has a constant difficulty focusing on a task, it can make it difficult for them to succeed in school or in work. In people with Down syndrome, symptoms of ADHD can often be difficult to tease out from their natural cognitive challenges. For example, impulsiveness might be a person's preferred method of communication when there is a particular stressor, especially in those patients with Down syndrome who have more limited verbal abilities. For instance, a child who impulsively yells and is easily distracted in loud environments might instead be communicating their difficulties with processing the auditory stimuli, despite impulsivity and distraction being features of ADHD. When separating ADHD from features of Down syndrome, it's important that both clinicians and family members work as detectives to determine if there's another physical, sensory, environmental, or lifestyle change that might also explain this behavior. Of note, the Diagnostic Manual Intellectual Disability, a resource aimed at helping clinicians diagnose psychiatric conditions in individuals with intellectual disabilities, requires that there must be clear evidence of significant impairment in social, academic, or occupational functioning that is related to inattention, hyperactivity, or impulsivity, and not just the intellectual disability. ADHD is relatively common. It is estimated that about 4% of the general population has ADHD, and the occurrence might be the same or even higher in patients with Down syndrome. As discussed previously, there are 3 different subtypes of ADHD: the hyperactive, inattentive, and combined subtypes. We will discuss the symptoms of all. In the hyperactive and impulsive subtypes of ADHD, someone with Down syndrome might be described as always bouncing off the wall. They might talk constantly or have trouble sleeping, seeming as if they have so much energy that they are driven by a motor. This might result in them being unable to sit still for long or interrupting others, such as calling out without raising his or her hand in class. On the other hand, someone with the inattentive subtype of ADHD might have difficulty with attention while doing activities. Even when they're asked to do something directly, they may not follow through. They might be described as a daydreamer. This is particularly true in individuals with Down syndrome, who often have very big visual imaginations, which makes them particularly prone to daydreaming. The inattentive subtype of ADHD is the more difficult to diagnose. Especially in individuals with Down syndrome, there is, however, a very important clue that can help diagnose this subtype. Typically, individuals with Down syndrome do not have difficulty filling up their free time with things they like to do, such as watching TV or playing outside. Even someone with Down syndrome who has the inattentive subtype of ADHD will likely not have difficulty staying focused when there's a set routine or with intense one-on-one attention. However, the clue will come if they have difficulties organizing themselves during their free time. It should be a red flag if someone with Down syndrome is unable to structure his or her free time to do something that he or she enjoys. To give an example, imagine a 6-year-old child with Down syndrome who was brought to the clinic due to several incidences of emerging aggression at school. In preschool, she had been a pleasant and hardworking student, but in kindergarten, she's become more restless and behaviorally difficult. Through discussions with her teacher, it is discovered that the child's recess time has been extended. leading to a prolonged period of no schoolwork. During this time, the child's restlessness, distractibility, and hyperactivity has begun to emerge. She is not willing to participate in some of the recess activities such as arts and crafts or kickball. Likewise, at home, her parents note that she does fine when she has one-to-one attention from another family member, but when she has free time, she's not able to settle down or entertain herself, even when given things to do such as drawing. This used to be easily solved when she had siblings living at home who would include her in activities. However, after they have left home in most recent years, her parents have noticed that she has become more restless, distracted, and hyperactive. This is a prime example of someone with ADHD and Down syndrome who is able to do well with routines, but not able to organize and entertain themselves during free periods. Finally, recall that if someone has symptoms that meet criteria for both the inattentive subtype and the hyperactive impulsive subtype, they can be said to have the combined subtype. Before treating a person with Down syndrome for ADHD, it is important to rule out other medical and mental health causes. There are several psychiatric and medical diagnoses that share symptoms with ADHD. For example, children with autism spectrum disorder have been misdiagnosed with ADHD. Children with Down syndrome and autism may indeed be hyperactive, but diagnosing them with ADHD alone ignores key aspects of autism spectrum disorder, such as difficulty with social interactions. Depression can also be misdiagnosed as ADHD, as it can present with decreased concentration and indecisiveness. However, the symptoms of depression are usually first seen later in adulthood than ADHD and are also not constant, often appearing in episodes. In addition, anxiety can present with distraction hyperactivity, but be aware that this again might be episodic only when there is a potential stressor, while ADHD is present in early childhood and occurs throughout the person's life. In addition, obstructive sleep apnea, a condition common in the Down syndrome population in which not enough oxygen is received during sleep, can lead to brain fogging and inattentiveness at school. Clinically, treating sleep apnea has resolved inattentive symptoms that were really never ADHD inattentive subtype to begin with. Finally, be cautious if a person has begun a new medication or supplement, as some have been known to lead to inattention, distractibility, and hyperactivity, but only in the context of usage. Of course, because there are so many medical and psychiatric diagnoses that overlap with both the inattentive and hyperactive subtypes of ADHD, as well as the combined subtype, it is important to consult a physician as a next step if you're concerned about any of these symptoms. Remember also that it's possible to have several of these conditions at once, such as ADHD with Down syndrome, autism spectrum disorder, and sleep apnea. This underlies the importance of a medical evaluation in order to examine the possibilities of these diagnoses. It is necessary to see a medical professional to be evaluated for ADHD. Examples of professionals that are qualified to make the diagnosis include psychiatrists, neurologists, psychologists, and pediatricians. Evaluation can include medical tests to exclude other diagnoses previously discussed, as well as screening tools and questionnaires in order to rule in or rule out ADHD. Given that the impairment and symptoms of ADHD must be present in at least 2 settings to make the diagnosis, some providers will give questionnaires to be filled out in 2 settings. For example, a pediatrician might give a questionnaire about asking ADHD symptoms to both parents and teachers. For more unclear or complex cases, it might be necessary for someone to undergo neuropsychological testing. This type of testing includes several tests designed to characterize a person's ability to perform cognitive tasks, including those that require attention. ADHD can be effectively treated once it's properly diagnosed. The goal of treatment is to improve attention, reduce impulsivity, and reduce hyperactivity. In addition, treatment of this condition can improve academic success and long-term outcomes, such as independence and successful employment. The first-line treatment in children less than 6 with ADHD includes behavioral strategies, such as behavior modification. This might come in the form of positively reinforcing good behavior. An example of positive reinforcement might include praise or a small snack after the successful completion of homework. For more tips and explanations of these approaches, check out the wonderful resource called Supporting Positive Behavior in Children and Teens with Down Syndrome by David S. Stein. In addition, the environment can be modified to remove distracting stimuli. Certainly, schools should be involved to increase in-class support for children who need it. While behavioral interventions can be tried first before medications in individuals between the age of 4 to 5, medications are the first step in treating school-age children older than 6, adolescents, and adults who meet criteria for ADHD. These medications can be used in combination with behavioral strategies, as additional behavioral therapy can address functional impairment. Medications have been shown to be effective at treating core ADHD symptoms. The medications used to treat ADHD include stimulants and non-stimulants. They're examples of both types, with there being more options for stimulant medications. However, there has been a study published which suggests that guanfacine, a non-stimulant medication, is effective in treating both hyperactive and inattentive symptoms with minimal side effects in the Down syndrome population. Use of this medication in individuals with intellectual disabilities has become common, driven by clinical judgment and benefits providers have seen from using it. Given this, it is often the recommended first-line medication in ADHD in Down syndrome. Thank you for watching this video, as ADHD is common in both children and adults with Down syndrome. It is particularly important to recognize symptoms so proper treatment can be put into place. Remember the clues to diagnosis that are particularly seen in individuals with Down syndrome. Of note, if you are concerned that you or someone you care for has ADHD, please consult a physician to begin the evaluation process and start treatment if necessary, as it is important to exclude other medical or psychiatric diagnoses. For more information, you can visit the Mass General Down Syndrome Program's website. Thank you for watching.